In today's Daily Dose with Dr. Marianne Bowman, a viewer asked how to prevent bladder infections.
Bladder infections are very common for women, less common for men. The reason is because women have short urethra. That's the tube from the bladder out. That's what we urinate through. Men have longer urethras because it goes through the penis, and so it's less likely for the bacteria to get up there and infect the bladder. Because when you have a bladder infection, that's what happens. The bacteria gets up there, and then it invades the bladder wall, and you have the symptoms. What are the symptoms? Oh, if you've ever had a urinary tract infection, you know. You get burning when you urinate. You get this intense feeling that you really have to go, and then you get there and a few drops come out, and then 5 minutes later you've got that intense feeling, and you can't have blood. It is very uncomfortable. And sometimes the bladder infections, a person can end up having a kidney infection where the bacteria is up into the kidneys. That usually causes more back pain, fever, chills, and is a little more serious. Now, the good news is that antibiotics will take this away, and the antibiotics concentrate well into the bladder, so it doesn't take a lot to get rid of them. But for some people, they are recurrent. We see these commonly in women around intercourse because there's a lot of bacteria from the rectal area. No matter how clean you are, there's bacteria around the rectal area. This contaminates around the vaginal and the urethral area, and the bacteria can travel up. That's why we tell women to urinate after intercourse, to help at least clear some of that away. Now, sometimes it's so common that a woman has to take antibiotics after intercourse. Sometimes we have to even have them take antibiotics on a regular basis because they have such a problem with it. One thing that you can do to prevent: cranberry juice. Cranberry juice does keep the bacteria from adhering to the bladder wall. And if it can't adhere to the bladder wall, then the infection cannot get going. So that's something that you can try as well. Good luck. You know, they did a study of college girls, and they found that 27% had another infection within 6 weeks. And it wasn't a recurrence of the same one, it was a reinfection. So it is not uncommon. Some women have these very often and can be very frustrating. If you're a male with urinary tract infections, we usually want to make sure that your prostate is not enlarged, because if the prostate is enlarged, then it blocks some of that urine from coming out and makes you more prone to urinary tract infections. So if you're a male with urinary tract infections, see your doctor. If you're a woman, you might want to try some of these things. Speak with your doctor if they are continuing to occur on a regular basis. Good luck.
And if you have a question for Dr. Bowman, call the hotline at 841-9999 or email her at drbowman@news9.net.